Let's talk about poo. Yeah, poo, you heard me. It's the end product of a really important bodily function. After nutrients are absorbed by a small intestine, waste is then eliminated by a large intestine. But what happens if your body can't actually do that? Well, ostomy is a life-saving surgery for anyone with a type of cancer that affects the digestive system or a person living with inflammatory bowel disease or genetic defects. The procedure reroutes waste from the digestive or urinary tract by creating a hole in the abdominal wall called a stoma. A small ostomy bag is then attached, which allows waste to collect outside the body. An ostomy can be reversed if the bowel can heal. Otherwise, it's permanent.
I was a cancer patient in 2011, a year of treatment, colorectal cancer. You have the bag, you have the problems, always afraid, should it leak or not. It's difficult, and you can't speak about it, about other people, because they don't know it. It's strange, and they don't understand it. And everybody is a bit afraid that accidents will happen also.
At the European Parliament, the EU branch of Cittadinanzattiva, the Active Citizenship Network, organised a discussion, Living with Ostomy, from invisible struggles to visible change, with the involvement of 21 patient advocacy groups across 13 member states.
Our objective today is to raise the rights of ostomy patients at the European level, and this is why I am proud to host this discussion. The figures we have are relevant. Over 700,000 people live with ostomies in Europe. We need to increase the assistance and ensure appropriate healthcare systems for these patients, because ostomy impacts their physical, emotional and social life.
Now, health may not be an EU competence, but for ACN's director Mario Novota, Europe had a massive role to play when it came to driving awareness.
We believe that the newborn Sant Committee within the European Parliament could address much more the topic on people living in a so-called invisible situation, starting with the people with a stoma.
Many ostomates feel shame, discrimination and isolation. At the Parliament, the Invisible campaign was unveiled. It's a first step by patient associations to unite and highlight the needs and struggles of the ostomised. Italian model and influencer Gaia Capone hoped that her participation would break down stereotypes. There are huge disparities across the EU 27 member states when it comes to the rights and opportunities of the ostomised. They not only need the physical care associated with pre- and post-surgery, there's also a massive mental and social element involved because of the physical changes to bodily function and the appearance of the body.
Nurses in Germany are aware of the quality and the specialization to take care of ostomates. So within all these years, now we have an organization about around 1,000 people who are doing this job in hospitals or out the hospitals. And the qualification you need to do and the education you need to do is around 1,200 hours.
But other panellists from across Poland, Italy and Spain painted a much grimmer reality of inadequate public infrastructure, access and reimbursement.
They have no stoma therapist, and also no different devices, no adaptations.
Frankly speaking, we have a lot of very not good stories, let's say, and not good examples how the ostomy can close you at home or just ruin the whole relationship with others, or you just decided to live alone just because of the ostomy, that you are afraid that someone will smell you or someone will see it.
There's no dignity for people to live behind doors and in their homes for so many years because they are scared of going out due to the fact that they have a stoma. People can live a really good life with a stoma. They can contribute greatly to society with a stoma. It is important that we, all of us together, help them to ensure a better foundation for self-management.
Pierre from the Italian Patient Association FAIS outlined challenges and recommendations that patient groups say the EU must promote. For him, a stoma equals life and freedom, but only if.
The phrase of the day is you must be lucky, because if you live in, for example, in a rich country, in a rich region, and you have hospital, you have assistance, you have care, you are lucky, and maybe your life could be better. If you live in a region less rich, with low services, low assistance, low care, you are not lucky.
Today's event at the European Parliament was a great first to raise awareness on ostomy at an EU level. The discussions were frank and they highlighted the need for the ostomized to be seen as humans and for stigmas to be broken. There's a big role the EU can play to effect change by recognising the rights of ostomates, ensuring equal access across all the 27 member states, but perhaps most importantly, creating awareness campaigns that promote positive dialogue and improve patient outcomes.